Welcome to Adapt English. Thank you for deciding to watch this video. You will never regret for clicking on this video. I have 30 good questions, high yield questions that you need to know. If you're taking your exams, in the next few weeks, I promise you, if you watch this video and you go and take your test, you will never regret. So stick around, listen to taking strategy, some content, good 30 questions that you would love to see. First question is that. See, it's a pediatric question. So is it select or apply? Reading from the back, right? The nurse should include which of the following? So what does she include? A nurse is caring for a 6-month-old client. The parent wants to know the stages of development by Erickson. You have to know that. If you forget, this is the easy way to remember them. I always start from the first one. The first one is infancy, before 1 year, so 0 to 1 year. And what does the baby do? They trust their mother. They look into the mommy eye as soon as they're born. It's a form of trust. And they start establishing that trust. So that's the first one, trust and mistrust. If they don't trust, they will be mistrust. So usually I look at one side and I do the opposite. So trust, if you don't trust anybody, you mistrust them. As soon as you gain trust, then from 1 to 3 years, you start taking autonomy. You know your mommy, you trust your mommy, so you can do things around. You can pull things around. You can move away a little bit from her. I mean, but you know that she's going to be there. And so that is 1 to 3 years. And that's how you start to get autonomy. If you don't achieve that, you be ashamed and you doubt whether to leave your mommy. You're always guessing, double guessing in your head. But as soon as you achieve autonomy, you start taking initiative about things. When you're in class, you start listening, raising up your hand, taking initiative, 3 to 6 years at the preschool years. If you don't do that, you become guilty. Anybody who take initiative, they're very industrious. So you see, you can think about it, you don't memorize it. So that's why you are very industrious. If you're not, you become inferior. So like they say, go getters, yeah, they are very industrious. And as you know, after you've taken the trust, you have autonomy, you've taken initiative, and you're very industrious. Guess what? You start knowing who you are. And that's that identity right here. If you don't, you have role confusion, identity crisis, role confusion. But so far as you taking initiative, you be industrious and making moves everywhere, you know, oh, I'm so and so. This is what I like. This is what I enjoy. And then you start chasing for men or women, right? That is autonomy, right? You start having intimacy because you know you who you are. If you don't, it become a problem. You isolate yourself. So you need to achieve a self of identity, self feeling that you know who you are. Then you start having intimacy. Guess what? When you have intimacy, you have babies, and then that's where you have generativity. You can share your things, you can give out your things, you'll be more lovely to everybody, and you see some growth in life. Otherwise, if you don't do that, you'll be stagnant. You can't have any companion, you can't share anything with anybody, right? That's stagnation. And when you achieve all of this, you have sense of complacency, like self confidence. You know that you've achieved what you have achieved in life. So you don't worry about anything. You have integrity of yourself and you can move on. When you die, you say, I've achieved all these things. There's nothing left for me. If not, you always have a problem, despair about what happened in the future. And so these are all correct. The next issue include in the stages. But this is the way I can portray it to you so that you can see what it means about Erickson. I don't know if somebody have taught it that way, but I want you to memorize only the first one, trust and mistrust. Then the ages usually change by 2 years. From after 0, it changes just from 1 to 2, 3 to 6, 6 to 12, 12 to 20 as you go down. So pay attention to that, those numbers. You just move a little bit and you start going up. And after you know that, go to the trust and mistrust and think about it. If I trust somebody, I've gained trust, I become more autonomic. And I start taking initiative. Then I be very industrious. Then I know who I am. I find a man, a woman. And then you start having intimacy, generativity, having babies. And then after that, sense of accomplishment. So all this should be included in the teaching. Okay, selected apply. But if you don't know, pick those that you're confident. Okay, so that's the first question. Number 2, selected apply. The same thing. A nurse is caring for a 3-year-old client diagnosed with what? Aplastic anemia. Keyword. What will be the teaching for the cause of the problem to the mother? She's asking for the cause. So the keyword, what I'm being asked is what? The cause of it, and the buzzword is what? Aplastic anemia. That's all. I'm looking for aplastic anemia and the buzzword. That's all. I don't need to know anything at all. I don't need to know anything about this problem except the cause of aplastic anemia. Well, this is a fancy word. You will see somewhere aplastic anemia. It's just a fancy word that the bone marrow that produce red cell, that produce platelet, that produce white cell is being destroyed by something. Something is like attacking the bone marrow. And there's certain things that can attack the bone marrow that can cause the problem. Viral medication, any antiviral medication that you take for viral infection, you got to be careful. It can cause aplastic anemia. The definition of aplastic anemia is bone marrow cannot produce sufficient blood product, not red blood cell, not white blood cell, not platelet, all blood products. So all the 3 blood products, okay? And therefore, usually this will lead to pancytopenia. It's the same where sometimes they can interchange it. Okay, so this is just the definition of that. Viral infection, yeah, very classic. If you're using viral medication, there's some viruses that can cause aplastic anemia, Epstein-Barr virus. Some medication can do that. NSAID and seizure medication can also do that. Radiation is very important. Exposure to radiation can destroy the bone marrow and certain toxins. All these things can cause. So this is pharmacology, something you're supposed to know. They can ask you. But the key word is aplastic anemia, and then know some of the things that can cause that. And this, I've given you the main one they can ask you in the test. Number 3, select or apply. Once again, you pick those, you're confident. If you don't know, you leave it. Don't guess unless it's 100%. And nurse is caring for 5 patients, right? Who should be seen first? Who do you want to see? You got to be sharp. And what does that mean to be sharp? Take care of the breathing problem, electrolyte, sepsis and shock, hypothermia and hypoglycemia, airway, and pain that will cause limb, life, eyesight. That's all. And when you know this, no prioritization question will mix you. And when you see a prioritization question, divide it into 2. The half side and the other side, what is the problem? A client with emphysema, okay? What is the problem? Hyperinflated lung on X-ray. That is the definition of emphysema. Their lung is huge and big because of his hyperinflated, and he has loses elasticity due to smoking and all those things. So you don't need supposed to see this patient. Client with multiple sclerosis with no urine since the Foley is removed 5 hours ago. Okay, they have multiple sclerosis. Don't freak out because they have multiple sclerosis. We put a Foley and they have no pee for 5 hours. Well, first of all, multiple sclerosis, they have urine issue. I mean, nerve problem, they always have a bladder bowel problem. At the same time, Foley removal, when we remove it, we give patients 6 to 8 hours. We can give you up to maximum of 8 hours. So even if you've 6 hours, you have no pee, no urine, I still can give you up to 8 hours if I want to. So, and even after that, you just need to assess the patient. You do a bladder scan and see how much urine is in their bladder. If there's less urine, you give them fluid. But this patient, 5 hours is okay. I'm not. If I pick that, I'm not being sharp. A client with myasthenia gravis with weakness at night. Guess what? Myasthenia gravis is not a problem. They have acetylcholine receptor problem. So they get weak, okay, during the night. During the day, they're strong. And so as they go through the day, they get weaker and weaker and weaker. That's why you tell them to take their medication in the morning. So this is an expected finding. If I pick it, I'm not being sharp. A client post-hip replacement 12 hours ago with petechia on the chest and neck. Well, I'm worried about this patient. Okay, as a hip replacement, that's big bone. Okay, all of a sudden there's petechia on the chest and that. This is fat embolism. Okay, so we have an airway and breathing issue or breathing issue. This is a B sharp moment. You got to be careful. This patient will have a confusion and they can have respiratory distress. So I need to watch this patient. The client with Guillain-Barré syndrome and leg weakness. Well, this has ascending paralysis. Leg weakness is normal. The only time I'm worrying about Guillain-Barré syndrome is what? Airway issue. So if they have swallowing problem, if their speaking is bad, they have slurred speech, yeah, respiratory problem, yeah, the same thing as myasthenia gravis. Apart from that, just weakness is not enough for me to see them. So I will see them later, but that's not important. So who do you see is number 4? Fat embolism. So just because they give you vitals on the case study, when they ask you about specific question on kids, they will give you their normal range. They're not going to give you. So you have to know normal range for kids and other things. For case studies, yeah, when they give you the lab work, they will give it to you. So you don't have to memorize. But for these numbers, you have to know it. I said this to tell you the way you can use this slide, you can take a picture and then memorize in your head. And they don't give you range, but I'll show you how. Who need immediate intervention? Select or apply. Pick those you're confident. And nurse is caring for the following patient. Who will? So there is a way you can remember this. From 0 day to 30 days, okay? 0 to 30 days. This is the blood pressure. I've given you the maximum. All this is maximum. So they can go up to 75 systolic and diastolic 50. These will drop, the diastolic will probably in the 50 range. And so 50 to 75, but I don't want to give you, the lower portion of the systolic, sorry. So 50 to 75. And so that is the way you go. But I've given you the maximum because usually when they give you some higher normal. Rarely do they give you in terms of blood pressure. You know when it's low. If I give you 20, you know this is low, right? So 70 is the maximum blood pressure for a 30-day-old. And the heart rate, yeah, it's 110 to 160. So I've given you maximum. And the respiratory rate is 60. So this is good. And as you go down, you can see that it decreases slowly, slowly, slowly. So just pay attention. 1-year-old, this is their maximum. This is the maximum heart rate. It just dropped by 10, and this also dropped by 10. A 2-year-old, so the 2-year-old up to, I've given you the end of it. So 1 to 2 years, this will be fine for them. 2 to 5 years, this will be okay. So 105, 103 is the maximum heart rate and respiratory rate. Therefore, 2 to 5, right? 2 to 5, then this will be 5 to 12. 5 to 12 years old, because this is the end of 12. So you have 110 to 70, and this drop by 20, and it start going down. So you can imagine in your head as you get older, the numbers become normal, slow. It start from the higher, and they start going, become smaller and smaller. 12-year-old to 18. So you can put 12-year to 18. This is their blood pressure, 120/80, heart rate of 110, and respiratory of 25. 18 is an adult. So when you have blood pressure of 180, 140 over this is not normal for them. Their maximum will be like 130. Their heart rate should be like in less than 100 because it's an adult. This is 105. Respiratory rate will be less than 20, like an adult. So this patient needs to be seen. But you can find somewhere, but you got to know these numbers. They won't give you this when they set it like that. Okay. Number 5, what will be the next action? A nurse is taking care of a client who has a cast buzzword for TFib fracture. Few hours later, the client started complaining of severe pain after all the analgesics were administered. What will be the next action? So somebody have a cast, that's the buzzword, to TFib fracture. You give them all your medication. They still complain of pain, severe pain. What would you do? What do you think is the problem? Whenever you hear cast and I have a severe pain, think of compartment syndrome. This patient is having early signs of compartment syndrome. Cold compression will not do anything. Warm compression will not do anything. You can call the ACP, that's fine, but the answer said for more medication, we don't need to give them any more medication. So this is a trap. Half of the question is answer choice is right. Call HCP, but don't give them more medication. You can elevate the limb to the level of the heart, not above. Be careful. If they put above, don't pick it. You elevate it into the level of the heart so that blood can flow through the limb, so that it can improve perfusion. You have a compartment syndrome because there's less perfusion. So if you elevate the limb to the level of the heart, more blood will flow. But above the heart, less blood will flow. So don't do that. So this one we elevated in at to the level of the heart. So this is number 4 is right. Patient want to know what class of drug it was prescribed, right? So what class of drug it was prescribed. And then she's taking care of a client who had a cash place for TFib fracture. Hydrocodone was prescribed for the patient. You want to know what class. It's not an NSAID. It's not an immunomodulator. It's an opiate. It's not an anti-epileptic. It's not acetaminophen either. So it's an opiate. That's hydrocodone. Hydrocodone, fentanyl, morphine, oxycodone, they are all opiate. And while we're here, side effect is what? Respiratory depression, number 1. They can cause hypotension, orthostatic hypotension. They can provide pruritus. They can lead to urinary retention also. They cause constipation. There's a bunch of stuff you're supposed to know. Okay, I'll give you all the side effect. Number 6, what would the nurse do? Okay, what will you do? You, the nurse. A nurse is taking care of a client on the cardiac unit with ECG monitoring showing premature ventricular contraction. So PVC. If you see a PVC, what is your management? Usually it's an electrolyte problem. This does not need to be shocked. This does not need to be defibrillated. It just means your electrolyte is all screwed up. So we got to figure out what is causing it. This is bad. Immediate cardioversion is not indicated. Immediate defibrillation is not indicated. Amiodarone is not indicated. You need to treat the problem rather than medicating the patient. So treat the problem rather than medicating the patient. Administer labetalol, treat the problem rather than underlying problem rather than giving you the medication. So notify the ACP. Usually they will get BMP to see what is the electrolyte, whether it's electrolyte screwed up, magnesium or anything like that, and or potassium, and we can replace it. So check lab first before you start giving them medication. You don't know what it is problem. It's a warning sign, that's all. Which of the following is contraindicated? And this is taking care of a client on the cardiac unit who is taking Coumadin, probably he has AFib or something like that. What is the problem with Coumadin? Coumadin is bleeding risk. When the patient is taking it, that's what it's telling them. So anytime I hear contraindicated, I'm worried about bleeding here. So if there's anything here that is going to cause bleeding, guess what? That's my answer. Tomato, broccoli, tofu, no. Saw palmetto is used for BPH, and one of the side effects is bleeding. So if you're taking it, we want you to stop it before you go to surgery. This will potentiate the effect of warfarin. So potentiation, that's why we don't take it. You make warfarin effect more powerful and you bleed more. So this is contraindicated. What finding is a priority to report? And this is taking care of a client on simvastatin. What do you think? Keyword, priority, simvastatin. Whenever I hear statin, I talk about rhabdo and muscle pain. Those are the key. There's a bunch of side effects, but the most important is muscle pain and rhabdo. This is B sharp. This is where you're being sharp. Because I know it causes nausea, it causes some headache, it can make you have some lightheadedness, it can cause some dizziness. But the most important is rhabdo. You're going to lose your limb. Muscle pain, you're going to lose your limb, affect your kidney. So rhabdomyolysis is a problem. I'm worried about leg pain. Which teaching is priority? Once again, priority, priority, priority. Your priority, B sharp moment. And then she's taking care of a client on lithium. I hear lithium, I'm worried about anything that affects my kidney. Okay, and what is number one? Dehydration. Therefore, I need to hydrate myself so that I don't get into trouble. I should not take NSAID that will affect my kidney. Anything that will affect my kidney, I need to worry about, right? And so, the problem with the lithium too, dehydration, is sodium, right? Sodium, low sodium can lead to what? Dehydration. It will make your lithium toxicity really high. So you want to keep your sodium at a normal level. This is the problem. This is the trap. So in taking lithium, I want my sodium to be not to be low, not to be high. If my sodium is low, it affects excretion of lithium. So lithium become toxic. If my sodium is high, then sodium is going to compete with lithium. And then your lithium level goes down and you have problem. So that's opposite. High level of sodium hypernatremia will cause his lithium level to be high, and the patient will have maniac episode. You want the therapeutic level to be normal. And if sodium is low, it makes lithium high. Therefore, we got to keep sodium normal, but not too high, just normal as much as possible. That's the idea. So don't reduce your sodium, don't avoid it. If you increase it, it will cause the lithium to be low. When lithium is low, you develop maniac. So adequate sodium is the best way. So, delegation. Which of the following tasks will be delegated to a UAP? You have a nurse, LPN, and UAP were working together in a unit. Which one of the following will be delegated to the UAP? Evaluating the care of a, the way I do this is UAP, anything that does not need any thinking. I know they're very smart, but anything that does not require any thinking, I'm giving it to them. The LPN do MMR most. That means they do most medication, that they reinforce the teaching, they monitor the teaching from the nurse, they can give most medication, like I said, take care of the stomach, G-tube, and then they can do special tests. The RN do it, evaluation, assessment, and teaching, and special medication, like high maintenance medication. The UAP, nothing that require thinking, right? Evaluation, it cannot do that. I told you E is RN. Evaluation can do that. Oxygen administration, this is the trap, right? Oxygen is a medication. It can be poisonous, so it has to be assessed, monitored. You cannot just slam oxygen on somebody. I know we do that all the time. But oxygen administration, oxygen is considered a medication. So UAP cannot do that. So this one, evaluation, this require assessment. So it's a medication. It can give medication. Bed bathing a 12-hour post-op patient. Yeah, they can bed bath the patient. Grooming the hair of a 36-year-old lady. Yeah, it's fine. I will put 86. No, 36 is too small. Serving a bedpan to a 7-year-old. Yeah, give them a bedpan so that they can poop. Yeah, it's fine. They can do that. So 3, 4, 5 is what they can do. They allow. But one evaluation and then oxygen administration is not acceptable. Which is the next appropriate response? The client was diagnosed with metastatic colon cancer. The client asked the nurse, am I going to die? So this is a therapeutic communication. You have to be therapeutic. That means listen to the patient, answer the patient they asking you. Don't pass the bags to somebody else. Don't call anybody. Don't promise them. Don't lie to them. Just answer the question. If you don't know anything, just keep quiet and let them talk. And the best way to know when they ask you a question, they know the answer. So tell them, tell me more, so that you continue to talk. Let them talk. When they're talking, you're doing good. But when you're talking, you are not doing anything. In therapeutic communication, that's what I said. If there's an answer choice and you are talking, it's a wrong answer. Okay? Let them be talking. Okay? We have the best doctors in the hospital. Wrong. Don't say that. They're saying that. Okay? You are not going to die. How do you know? Can you tell me more about your statement? Yeah, let them talk. Let me call a chaplain. They ask you a question, don't call a chaplain. So that's the right. Number 3 is the right answer. Which of the following is appropriate? So this should be a nurse is taking care of a 4-year-old client diagnosed with ADHD. The mother wants to know more about the disease. Which of the following is appropriate? So basically, patient has ADHD. And the mother wanting to know more about the disease, so you got to provide some teaching. You got to know certain content of the problem. That is what he asked me. So what do you tell the mommy? I mean, what do you know about ADHD? The definition. Take the definition and add some content to it. It's a select or apply. So pick those that you think you're confident, right? Attention deficit hyperactive disorder, right? So they have attention deficit, trouble holding attention. You see what I'm doing? Using the definition of the problem. They have problem with organization, attention deficit hyperactive disorder. So they will have issue with organization. They have attention deficit hyperactive disorder. So they will be easily what? Distracted. You see what I'm doing? Look at the way. That's why you should. That's the way you should take a test. Let him do breathing exercise if temper tantrum. Yeah, you distract them when they doing temper tantrum. Let them calm down. Focus on the breathing exercise, or let them blow into a balloon. They'll be fine. Have a written task or activity for them. Attention deficit hyperactive disorder. They can't pay attention. So if you give them something they can look to, they say, I need to wash my clothes. I need to do this. I need to do my own work. They have a list of it. They will never disappoint. So that is the key word. So I'm going back to the main activity every time I'm going in. Calm environment works best for them. They're already hyper. You need to calm them down, like a bipolar patient. Let them calm down. And methylphenidate can be of help. Yeah, that's the medication. It's a stimulant, but it rather calm them down and let them concentrate. The problem is it causes insomnia. They can't sleep. It makes them lose weight because they cannot eat. They don't want to eat. So you should take the medication in the morning. Otherwise, they won't be able to sleep if they take it at night. I intentionally set some of these questions this way to give you all the content you need in case I don't know what kind of question it will ask you. So if you look at it, you're just reviewing content, attention, and deficit hyperactive disorder. I've given you everything about that problem with all the condition you need to know about it. Okay? Good content. Number 14. Which diet is appropriate? A client was diagnosed with acute pancreatitis. Think about it. The pancreas secretes what? Amylase and lipase, and also insulin. These are used for fat digestion, and this is used for glucose. So it's one of the signs and symptoms is fatty stool. For pancreatitis, large voluminous fatty stool, because what? There's no lipase amylase to break it down. So what kind of diet would you give them? High carbohydrate, they're having sugar issue here. High fat diet, they're going to have a lot of fatty stool. Low fat diet is good. No fat diet is wrong. You need some fat in your diet. That's because they have pancreatitis. Doesn't mean they shouldn't eat any fat. Fat is the most important source of energy that we have. It can give you 9 kilocalories per gram compared to glucose or carbohydrate. So you should not avoid, at least have a little bit of fat in your diet. Okay, so number 4 is okay. Number 3 is fine. Sorry, number 3 is the right answer. So endocrine, like I said, this cover everything, right? Select and apply. A client was diagnosed with diabetes insipidus. Which of the following the nurse should expect? So this is a good content question, right? In DIA, what is the problem? No ADH, right? What does ADH does? You hold on to water. So if there's no ADH, I will lose all my water. If I'm losing all my water, my urine will increase. So urine output is increasing. So I will pee 5 liters over 24 hours. If I make a lot of urine, what is coming out is just water. Therefore, specific gravity is going to be low, right? Specific gravity of my urine is going to be low. If I have SIDH, yeah, I pull all the water and the urine specific gravity get higher. So I expect my specific gravity, which is usually 1.003 to 1.030. This is the upper normal. This is the lower. My specific gravity should be less. It should be here. It should be less than 1.003. So this unit specific gravity is 1.034. That's wrong, right? It's a DI. DI, you peeing water. So if I'm peeing water, my specific gravity should be low. Urine sodium higher than normal. If I'm peeing water, my urine sodium is low because my specific gravity is also low. Wrong answer. Sodium of 135. Well, if you pee all your water out, your sodium, what? Your blood get concentrated, right? And your sodium goes up. Your serum osmolarity also goes up. So I know my sodium 135 is almost close, but it should be higher than 135. It should be close to like 140, 145. So this one, I'm not picking it. It's too low. Even though this is the normal range, I want it to be like 140, 145 because of DI. Serum osmolarity is what? 300. Okay, serum osmolarity is 300. So what do you expect? The serum or normal serum osmo is close to like 270, 275 to 280. Therefore, if my serum osmolarity is going to be high, 300 is good. Serum osmolarity is high, so good. If my serum osmolarity is high, my sodium is high, my blood is concentrated, I expect my hematocrit to be high. So this is what diabetes insipidus does. You have ADH, you have no ADH, so you pee all your water off. There is no ADH, so all the water is lost. Your blood is concentrated, your sodium is concentrated, your hematocrit is high, your serum sodium should be higher than 125, 135, and urine sodium should be really, really low. Urine specific gravity should be low, and you pee a lot. So 1, 5, 6, and 7. Okay, that's what is expected. A client was diagnosed with acute gout flare-up. Which of the following is the most important to include in the plan of care? So which one will you include in the plan of care? Most important in a plan of care. When you have acute gout flare, usually it's mostly uric acid production. So we want to decrease uric acid, but not at the time of the acute flare. It's too late. You can't do anything when you have acute flare. Acute flare treats inflammation. You've lost the battle of treating the uric acid. And the medication you take for uric acid is this to prevent a high level of uric acid, right? But now you have flare, you already had the uric acid, so you're going to hurt, So the most important is what? Treat the inflammation. So allopurinol is not the right answer. This is not the best medication to treat inflammation. Hydrochlorothiazide, one of the side effects of hydrochlorothiazide is, I call it hypergluc. With the H, hypergluc is glucose, L is lipid, U is uric acid, and C is calcium. So it causes hyperglycemia, hyperlipidemia, hyperuricemia, and hypercalcemia. So your uracil is going to be high if you take hydrochlorothiazide. So one of the things you should avoid is hydrochlorothiazide. The best anti-inflammatory is colchicine. Niacin is a vitamin B3. It also increases your uric acid. So people who have gout should avoid uric acid. Patient has an acute gout, they shouldn't be taking niacin. It will worsen it. So the right answer is number 4. Which of the following is consistent with the diagnosis? So I want to know which is true with the diagnosis, right? A client is 28 weeks pregnant, present to the L&D for evaluation, which she was diagnosed with preterm labor. So I'm in preterm labor. What she shows that I'm preterm labor. When you're in labor, the cervix should dilate and efface. Your pain should start from your back to your abdomen. That's all. And the contraction should be regular. Keywords: regular contraction, but there's no cervical dilation. Okay, so cervical dilation. Therefore, I'm not picking this answer. Regular contraction, no effacement. Yeah, I'm not picking it. Irregular, I'm not even reading the rest of the question. I'm using test taking skills. Regular contraction with cervical effacement and dilation. So this is the right answer. Okay, we are in OB, right? Select or apply. The next should anticipate prescription for what? Yes. A client is 38 weeks, the same patient, present with the lower back pain radiating to the abdomen. She was diagnosed with preterm labor because she's not over 37, so she's 28, so preterm labor. The next should anticipate which prescription. So somebody is preterm. Keywords, preterm. You see what I do? I always go for the preterm. I forget about the rest of the question. I know SATA. I'm going to pick those so I know. But the keyword is preterm. What is preterm? I'm contracting that the baby is not ready to come out. What do I need to do? Stop contraction. Keyword, stop contraction. Magnesium will stop contraction. Dinoprostin, look at it. Prostaglandins. Prostaglandins are used, even if you don't know, I put this here, prostin, to ripe the cervix. And this will cause the baby to be born. So you can use this for abortion. You know, it will ripe the cervix and it will open the cervix and the baby will come out. We should not ripe the cervix. So this is wrong. Ditotrain, yes, is used to prevent contraction. So this will prevent contraction. So this is very good medication for that. Calcium gluconate is an antidote for magnesium. So it does not go there. Metallogonovin is used for was postpartum hemorrhage. So you cannot use this. So the two medications that can be used to prevent preterm labor is magnesium and Ritodrine. They prevent contraction. That is OB. Number 19. Select or apply. A client, 28 weeks, the same patient, present with lower back pain radiating to the abdomen. I'm trying to hit everything in it. She was diagnosed with what? Preterm labor. Which of the following should be included in the plan of care? Now, same patient, we have preterm labor. We want to stop contraction, but there's other thing you can do, right? You give them steroid, right? Metamethasone. This will increase surfactant in the baby. If the baby is going to wait for 2 days before they can be delivered, yeah, this will improve surfactant and improve their lung function. Estrogen is not needed. You saw this, right? Ritodrine, right, will stop contraction. Terbutaline is another medication. You can use it in asthma too. It's a bronchodilator in a lung, but this can stop contraction. Magnesium, stop contraction. So these are our pharmacology for you. Okay? So do you know this medication for OB in preterm labor? Okay. Order the steps below, the nurse should instruct the parent. A parent called the peds clinic because his son is having epistaxis, so nosebleed. So if you have a nosebleed, you call and the nurse was involved, pick up the phone. What instructions do you think they will tell you? I can tell you. I can tell you that the first thing you should do is calm the kid down. calm, okay? Just calm. Everybody will freak out when they see blood. Everybody will worry. Ensure that there is calm environment. Number one. Then people always make this mistake. When you have a nosebleed, don't put your head back. We all do that. Put our head back. And what we do is we swallow the blood and we can aspirate. The best way is to let the blood drip on the floor. So you remain upright with your head tilted forward. So this is number two. Then you hold pressure, direct pressure for 15 minutes. Don't take your hand off. Let your hand stay there for 15 minutes, right? Then after you can put the ice to help on the put the ice on the to cause vasoconstriction. That will help also. The number four. If none of this help, we got to go to the emergency room. So first, quiet environment, move forward, direct pressure, ice, and then we go to the emergency room. That is the order of steps. Which of the following is indicated? Select and apply. Same thing, right? Same strategy. A client with diabetes take what? Insulin at night before bed, but always wake up in the morning with high blood glucose level. Which of the following is indicated? This is what we call Sonogram effect. They take their sugar medication in the evening, they eat, then they go to bed. Sometimes they don't eat, but they go to bed, they wake up in the morning, and their blood glucose is really high. It's due to this effect, sonography effect, because usually the blood glucose it start from here before they go to bed. As soon as they take their medication, it drop, and then it become really low in the morning. And then you release steroid hormones like glucocorticoids. You remove epinephrine because your sugar is low. They become hypoglycemic. The body wants to increase more glucose, and they wake up like that, sugar like that. So the best way is to change the timing of this nightly medication, the type of medication or amount. So adjust the timing of the administration. Yeah. Lower the dose of the insulin before bedtime. Yes, that may help. Change the type of insulin too. Give morning insulin early. This does not do anything. So these are the things you do. 1, 2, 3 is the best way. Which of the following the next should include? So it's a select or apply. A client present to the PET clinic, inquire of what? Medication to prevent what? Respiratory syncytial virus infection, RSV. They like these questions, this topic, RSV. You got to know in case they like it because it's common in the flu season. How to in the case form. You should learn more about it in the case form and how to look at it, how to treat it, what to look for. Because it look like somebody is having respiratory distress, but sometimes it's just a simple, normal running nose with respiratory issue, but they do fine. You don't have to do anything. So, which of the following the next should include? So, because it causes very common, it causes a lot of problem with this medication. Sometimes we give injection, it look like a vaccine, but it's not true vaccine. And this is a monoclonal antibody, and this is palivizumab. Every time you see MABs, they are monoclonal and antibodies, and they are immunomodulators, and we can do injection for that. Every time you have monoclonal antibody, MAB, if they ask you about side effect, hypersensitivity. So usually it's antibodies being injected you. So sometimes some people are allergic to that. So hypersensitivity to that. It's a monoclonal antibody. What does antibody do? It provides passive immunity because it's not infection that you get in. So it's not an active immunity. This is a passive issue. and they bind to the RSV fusion protein. This is the mechanism of action of that medication. So it is the action mechanism of action. Okay, but this is fact about it. Tocilizumab it causes hypersensitivity, monoclonal antibody, provide passive immunity, and the location you bind to do its job is that. Okay, more questions. I told you 30 questions. This is very important. You should know this. A client 35 weeks present to the OB clinic requesting vaccination. She wanted a vaccination. Which of the following may be administered safely and appropriately? When I hear a pregnant lady going to have vaccination, the first thing coming to my mind, this test taking skills. No live vaccine. That's all. Therefore, I'm looking for live vaccine. If I see live vaccine, I'm taking it out and I'll leave whatever is left. So measles is a live vaccine. Polio, the oral form, is a live vaccine. Varicella, live vaccine. Intranasal influenza vaccine is live. The IM one is not live. Rubella is also live. Mumps, live. HPV, live. DTaP is okay. So MMR, they usually give the mumps, rubella, and measles all one. So this one coming one. But those are all vaccinations you should avoid in a pregnant lady because they are live vaccine. They can cause congenital problem for the baby, especially the rubella cardiac problem. Okay. 24. Which medication the nurse should anticipate the MD will prescribe? A client with history of diabetes has severe gastroparesis. So they have gastroparesis. That means it's a motility problem. It does not, the bowel does not move. So mostly for the stomach, and it's the food stay in the stomach for a long time, and they get dilated, bloated, and they have reflux, and they don't like that. So what medication do you use? The good news, the medication is used for nausea, but it make your bowel moves. Ondansetron is not it. It's used just for nausea. Promethazine is also the same. Omeprazole is a PPI. This is used for nausea. Metoclopramide, but it's very good. It has a motility that help with the gastroparesis. So this is the drug of choice. Metoclopramide, Reglan. Another name they use is Reglan. In your test, you call it metoclopramide, and it's used for motility. It can give you drowsiness and other thing. All these things has extra pyramidal side effect, except the omeprazole. But you improve your motility and gastroparesis. That's what it is for gastroparesis. Number 25, which medication the nurse should anticipate? You see a bunch of pharmacology, right? A client with severe vitamin B3 deficiency present to the PCP requesting treatment. Which medication should the nurse anticipate? This, I want you guys to know the vitamins. So vitamin B1 is thiamine. 2 is riboflavin. 3 is niacin. Okay. 6 is pyridoxine. And 12 is cyanocobalamin. So, well, will you give them B12 deficiency, B3 deficiency? They get niacin. Simple, straightforward. But I have like 3 follow-up questions. Which of the following is the common side effect of the medication? Client with severe B3 deficiency present to the ED requesting the PCP requesting treatment. Client was prescribed niacin. What is the side effect? Leg pain, not important. Angina, not bad. is not part of it. Leg pain, angina is not part of it. Pneumonia, no. The most important side effect everybody knows about is flushing. Flushing is what patient hate. It gives them is due to serotonin effect. So that's why people hate it. So you give you flushing. So you got to warn the patient. Face is all going to get red. So this is what you give them. Selected apply. A client with watery diarrhea and abdominal pain after ceftriaxone was diagnosed with what? C. difficile, right? They have watery diarrhea. They prescribe them antibiotic. Now they just diagnose them with C. diff. You're in pharmacology for your NCLEX, they'll give you the medication. They tell you what it's used for, and then sometimes you got to figure out or the side effects. So they take ceftriaxone, which is penicillin derivative, okay, and they develop what? C. diff. So which medication will you give them? I've said it, therefore I have to treat them. There's no precaution, that's medication. Motrin is not used for that. Cefepime is the same as penicillin derivative. If ceftriaxone is causing C. diff, would you think cefepime would be free? No. So both of them can cause the problem. The most important medication that is used for C. diff is metronidazole, vancomycin, fidaxomicin. These three medications, I want you to know it really well. These are medication we use for C. diff. The common one is metronidazole, right? If you don't see the answer choice there, don't forget vancomycin. If you don't see the answer choice there, pick fidaxomicin. It's a difficile. Fidaxomicin, mycin, or whatever you want to call it. But that's the one of the medications that we use. So these are the three medications that you can use for C. diff. Okay, pharmacology. Three more, then we're done. Selected apply. Which of the following information is very concerning? A client, 40-year-old, present to PCP asking about colon cancer risk factors. Which of the following is very concerning? So which of this is very concerning about risk factor for colon? The number one risk factor is family history of colon cancer. Okay, and it's worse if the person who had a colon cancer was younger, less than 50 years old. That's number one. There's other things that can also cause colon cancer. Inflammatory bowel disease, these two, inflammatory bowel disease, different from IBS. Inflammatory bowel disease, even though it's spelled IBS, is inflammatory bowel disease. Okay, so ulcerative colitis, yes. Crohn's disease, yes. Mother with colon cancer at the age of 40, they are worrisome. Irritable bowel syndrome, although it's spelled IBS, it's not the same as inflammatory bowel syndrome. I intentionally put the syndrome there because in order to come back, I want to come back to it. Don't call this inflammatory bowel syndrome. We don't use the word anymore. We use inflammatory bowel disease, IBD. And then we use this as inflammatory bowel syndrome so that people can, because this is a syndrome of collection of disease process, but this is a true disease. So ulcerative colitis and Crohn's disease are IBD, inflammatory bowel disease. So this is wrong. I just want to go back to it so that I intentionally use it so that you understand why the point. This is the problem. People get confused. Irritable bowel syndrome is just they have diarrhea, constipation alternating. So that's why it's a syndrome of symptoms. So those one does not cause colon cancer. Sister with the history of polyp at age 40. This is a problem. Younger age and a sister has polyp. So it's a first degree relative. So this is first degree relative. That's also a risk factor. So this is fine. 1, 2, 3, and 5 are very concerning for this 40-year-old client. Which of the following the next should include? Okay, select or apply. The client with a known history, known schizophrenia was brought in by the mother due to psychosis. The mother wants to know about signs of positive symptoms. So you have to know there's positive symptoms and negative symptoms. The way I remember it is negative symptoms are all depressive mood. Anything depressive for another. Or you can look at the positive symptoms. You say there's only 3 of them. It's hallucination, disorganized thought, and delusion. These are the ones we take medication for. They're very responsive to antipsychotic medication. Flat affect is sound like depressive, lack of energy, disheveled appearance. These are all negative symptoms. Medication does not help with that. They need psychotherapy. So disorganized thought, hallucination, delusion are positive symptoms of schizophrenia, while flat affect, lack of energy, disheveled are negative. But the only 3 of them. So don't worry about memorizing. Just know them and then you'll be fine. Last one. What is the initial management of this condition with stable vitals? That means you got to read the rhythm and then see what you need to do with stable vitals. Patient is stable. What do you think? How do you read the rhythm? I find if there is sinus, I look for RR interval. And when I look at it, this is not sinus. So it's AFib or a block, AV block. But AV blocks, like you can see P wave. You don't see any P waves yet. You usually see the QRS dropping if there's a different kind of block, type 2, type 3. But here, there's no, I can't even discern the atrium. So I know this is AFib. If it's AFib, number 1 is ventricular rate control is the most important. So control the ventricle. So anticoagulation is the secondary, was second important. Isosulfide, so there's heparin here. So you can choose both. How can you say heparin and coumadin? So that's the test taking scale. So those of them is gone. Isosulfide is a venodilator. It doesn't control the rate that much. So amiodarone is your best friend. And so this is the end of it. So like I said, AFib rate control is the most important. This is the end of it. Very extensive questions, very cover broad areas, but you have to watch this. And I'm glad if you've come to the end, thank you. But you'll be happy. You cover a lot of information. Thank you for staying around and keep charging as always. Subscribe if you have not subscribed. All the best of luck. Bye-bye.